My name is Professor Nathan Condon, and I'm here to host a webinar today to introduce you to the MPH and Global Health at Queen's University. I recognize we are in extraordinary times right now with the COVID epidemic, but Queen's very much remains open for business. All of us are working from home, myself included. In fact, that's why you aren't seeing me on video right now. During the time of the lockdown, my children who have returned and are living with us at the house have challenged me to grow a beard, and I'm not quite ready to go public with that. Nonetheless, we're very excited at the opportunity to tell you a little bit more about Queen's University, about our School of Medicine, our Center for Public Health, and about the MPH and Global Health. I'll tell you first a little bit about myself before I begin. I am, as those of you who are good with accents should be able to tell, an American. I'm trained as an ophthalmologist at Johns Hopkins and worked for many years in China, where I was based with my family. My focus is on research to try to improve the quality of vision care in low resource areas. And I'll be speaking to you a little bit about my own work over the course of the webinar. Once we've finished introducing the university and our program in global health, we will also give you a chance to meet some of our students virtually. There'll be a recording where they talk a little bit about their own experiences with the program. And then we'll have a virtual chat at the end where you'll have the opportunity to use the chat feature to share your questions, which I'll try to address here orally during the presentation itself. So without further ado, I myself have lived in Belfast for 5 years now. My family and I were living in China for 10 years before we came here. And I have to say that I have found Belfast to have a wonderful quality of life for myself and my family. As highlighted on this slide, that's a combination of a terrific quality of life and a very low cost of living, one of the lowest in the UK. Of course, from your perspective, you wouldn't be coming to Belfast just because it's a nice place to live. You're keen to know about Queen's, and Queen's University is ranked among the top 200 universities in the world. Belfast has many appeals, including cultural appeal, a fascinating modern and older history, presence on the island of Ireland, one of the world's most beautiful countries. For those of you coming as students, you may be particularly and understandably wondering about safety, and I'm delighted to tell you that Belfast is the safest region in the United Kingdom. Northern Ireland has the lowest rates of crime. Belfast is also one of the safest capitals in Europe. This is a place where you can feel comfortable walking around pretty much any place, pretty much any time, without having to be terribly concerned about your personal safety. Belfast, the Queen's University Belfast is one of the dozen or so oldest universities in the United Kingdom. It was founded in 1845, over 150 years ago, and it has a university, it has a campus rather, which really does reflect its history and traditions. And here you see the beautiful Lanyon building, one of the real highlights of the campus architecture. It is a very charming and beautiful place, and certainly one of the appeals for many people is the opportunity to come and see buildings that are old and very European looking. Some facts about Queen's University Belfast, or QUB as we call it. It is the 9th oldest university in the UK, a country with many old universities. Has already passed its 150th anniversary. It's 25th in the world for international outlook. We have a current program, Vision 2020, that was started by our prior VC, which is really aimed to improve and increase Queen's outward-looking stature. We're very much a Northern Irish university but we're also a European university and a global university. We have nearly 3,000 international students, and that number is growing very rapidly, partly because of the appeal of life in Belfast, and of course because of the appeal of the university and its many programs. We're a member of the Russell Group, which is a small group of between a dozen and 2 dozen top research-intensive universities in the UK. Alongside us in that group are Cambridge, Oxford, and Imperial College London. So clearly we share some quite good company as being among the best universities and top-ranked universities in the UK. With regard to our research, we have a number of strengths. First of all, we've been very effective in bringing in new research awards, over £100 million in research in the academic year 2016 to 17. That places us 8th in the UK for research intensity during the most recent REF process, and we expect to do at least that well, if not better, in the current REF, which is will be completed this year and next year. Queen's is one of the top 30 most effective publishers in the world. So we are good about translating our results into published papers to share with our colleagues. And perhaps most importantly and impressively, Queen's has been rated number 1 in the UK for commercializing research. So we're very keen to see that the work that we do is shared with colleagues and translated into real world applications. So a little bit now about the Faculty of Medicine, Health, and Life Sciences within which the Center for Public Health finds itself. This faculty consists of the schools of medicine, dentistry, and biomedical sciences, of biological sciences, of pharmacy, which is one of the top in the world, and of nursing and midwifery. So the faculty here has resources within the broader world of medical care that are as rich as any comparable university. This map really just shows a small sampling of our global partnerships. They include the National Cancer Institute in the United States, our own campus, China Queen's College in Shenyang in northeastern China. But we have a much broader array of connections beyond what are represented here, including numerous institutions with whom we have memoranda of understanding in South Africa, across China, in India, in Malaysia, throughout Latin America, and of course many in the United States as well. The Center for Public Health, which is what I call my academic home and which is the host of our Global Health MPH program, is committed to identifying risk factors that are important for the health of individuals and for the population, ultimately in order to reduce the burden of chronic disease in the future. We have over 140 staff, including academicians, technical support, researchers. We have over 60 PhD students, 2 dozen MPH students each year, and our research income over the last 3 years has topped £20 million. The large majority of that comes from outside of Northern Ireland. So clearly we are very much a globally facing center. The center profile, we have multidisciplinary research teams in a number of areas. Epidemiology and public health, where there's interest in the prevention and social epidemiology, genetic epidemiology. We have a large cancer epidemiology group, a health services research group with whom I interact very closely, and also a group in nutrition and public health. In all of these teams, all of these groups, we're looking to improve health and healthy aging while working hard to reduce inequalities and to prevent and manage chronic disease and disability and improve the delivery of health and social care. Increasingly, these groups are all of them deeply concerned with global health. My own work is almost 100% focused on global health. And that's the case for a number of my colleagues working in ophthalmic epidemiology and our eye health group. Increasingly, our cancer epidemiology, nutrition, health services, and epidemiology groups are all deeply involved in global health. It's unquestionably a growing area of focus for the Center in Public Health. Our core mission involves a number of aspects, but really these are around building academic capacity. So obviously those of you who do come and study here and then return to your own countries are a crucial part of that. We view multidisciplinary work as crucial to what we do. So for myself, I work with economists at Stanford. I work with business school researchers at the University of Michigan. I work with ophthalmologists in China and Vietnam, Mongolia, India, numerous places around the world. I work with NGOs. I work with economists. I work with medical anthropologists and numerous other groups, traffic safety specialists. And I think that would be true of most of my colleagues. We're intensely collaborational. We're keen to reach out and collaborate with folks that are working in other fields. We want to increase the evidence base. We're interested not just to publish papers, but we also are very strongly committed to create new work, new research that will help to change policy and will help to change the face of how healthcare is delivered. Speaking personally, I have a strong interest in trials that show the various ways in which good eye health can help to achieve the Sustainable Development Goals, improving educational outcomes in children, improving the productivity of workers, trying to improve the safety of our streets by improving the vision of drivers and helping to enhance traffic safety. And a number of these things, a number of these publications in these areas have helped to change national and international policies, including a large program in China that began in August of 2018 to try to manage the problem of uncorrected refractive error in children. So the work that we had done demonstrating that providing glasses improves children's educational outcomes helped to promote those new policies in China. We also want to evaluate innovative methodologies, and we want to complement other research council initiatives. So again, very collaborationist and outward looking in our core mission. Speaking briefly about the different research groups, the Health Services Research Group has a number of interdisciplinary research strands. These include healthcare improvement, health economics and policy. Professor Kieran O'Neill is a health economist with whom I work very closely. Often, particularly in global work, it's crucially important to be able to tell policy planners, to be able to demonstrate to policy planners which interventions are going to give the biggest bang for the buck. So this kind of health economics work, cost effectiveness, is crucially important. We do methodologic studies, including Professor Mark Clark, who is a well-known expert in randomized controlled trials and who has worked with an organization called Evidence Aid that has helped to gather information, publish information, in particular around global humanitarian crises to try to provide the best data in over the quickest period of time to help to mobilize resources in a data-driven way when humanitarian crises occur. And Professor Clark is involved right now in marshaling the evidence around COVID-19 to try to help to drive our response to that crisis. We've also had important research in ophthalmology and vision research. My colleague Tunde Peto, myself, Professor Augusto Arcelora Blanco, Dr. Bing Tai Chan, Dr. Ruth Hogg, and also Professor Noemi Luis. All of us together are probably about 7 or 8 ophthalmologists and other vision professionals with a strong and primary interest in public health and the ways in which public health research can help to drive better policies for improved vision in low resource areas. We also have a unique group that works on oral healthcare research, and there are obvious connections between that group and our nutrition group. Having healthy teeth and a healthy mouth is crucial for good nutrition in the elderly. So speaking briefly about my own work in global eye health, the aim of that work is to try to improve quality and accessibility of inexpensive eye care in low resource areas. I do a lot of work not only with my own colleagues at CPH, but also partners in a number of low and middle income countries. We have ongoing projects in a dozen different countries in Asia, Africa, and Latin America in my group. In terms of working with NGOs, I do spend a substantial proportion of my own time, in addition to being a professor at Queen's. I'm also director of research for Orbis International, which is a US-based eye health organization. And I also have an academic appointment at Zhongshan Ophthalmic Center, the largest eye hospital in China, which is where I was based with my family for the better part of 10 years. In terms of my own research, we have a strong interest in refractive error. We've carried out a number of randomized controlled trials to be able to demonstrate that providing glasses and improved vision helps to improve children's educational performance. We're now sponsored by the UK government to do a large trial in Western China that is designed to demonstrate that giving free spectacles to children can not only improve their grades, but can also increase the proportion of children that go on to high school. That's currently only about half of kids that attend academic high schools in rural Ningxia province where we're working. And our hypothesis is that by improving their vision, we can enhance that number. We've also done a lot of work around productivity. We had a recent trial published in Lancet Global Health showing for the first time that providing spectacles can very significantly improve the productivity of workers. And we have additional trials that are soon to be published or are currently being carried out that are going to extend that work into other sectors, the agriculture sector, textile sector, to try to demonstrate a number of different ways in which we can help to fight poverty by improving vision with very low cost interventions with spectacles. In the area of cataract, we're very interested in the impact of surgery on economic well-being. We've developed an app called Boost that's freely downloadable, better operative outcome software tool. It's designed to help surgeons working in low resource areas to measure and improve their outcomes for cataract surgery. We work in diabetic retinopathy. Here, a lot of the work that we're doing is being fed back immediately into eye health programs from Orbis International. So the better approaches in terms of the use of artificial intelligence to do grading, training graders who don't have medical backgrounds so that we can do task shifting and help doctors to have more time to provide actual treatment. With regard to glaucoma, we're interested in interventions to improve postoperative follow-up and satisfaction. We're interested in novel treatments. And we've also had a paper published very recently showing for the first time that outreach screening for glaucoma can be highly cost-effective in low-resource areas, which is quite different, actually, than is the case for richer countries. And we also, in our group, have some work in Northern Ireland in school vision screening and follow-up after cataract surgery. So to speak about the MPH and global health, this is a relatively recent addition to our coursework in global health. The MPH in global health is designed to provide participants with a good understanding of global health issues and how those issues affect public health policy and also practice. One of the most exciting aspects of this course is that it's largely taught by people like myself and my colleagues, such as Monica Bush and others who are public health practitioners who spent our careers doing public health work and not just research. So there's a lot that you can learn about the practice of what it means to be an actual public health person working in the trenches. We provide exposure to global health politics, policies, systems, and practices. The first semester is largely spent in learning the important tools of public health that include epidemiology and biostatistics. Those are really the language of public health. Those are the tools that we use in order to frame the key questions that drive public health. What kinds of interventions can we do to improve the health of populations? The Center for Public Health at Queen's hosts one of 5 UK clinical research centers of excellence in public health. And one of the key aims of that center is to encourage multidisciplinary work and to increase capacity to address complex population mental health issues. There's plenty of opportunity to interact with that center, and that is an important aspect of the work that you'll be doing during your training. The program content is divided up over a full year from October to September. As mentioned, that first semester is largely focused on building the basic tools that you need in order to function as a public health professional. These include public health sciences, determinants and improvements of health, and medical statistics. These 3 courses focus on basic building blocks like epidemiology and statistics, and they're shared between students in the regular MPH and the global health MPH track. In the second semester, we have 4 taught modules, 3 of which are specific to our global health MPH. And it's really at this point that a lot of the very specific global training occurs. We have health and social care systems that helps you to understand how a health system is created, the key building blocks that are utilized in order to improve healthcare systems. We have a course on global non-communicable diseases. I think often from looking at coverage of things like Ebola, we get the impression that people in low and middle income countries are largely being threatened by infectious diseases. But in fact, in many of the countries where I work, and many of the lower middle income countries in the world, diabetes actually kills more people per year than HIV, AIDS, and tuberculosis together. So non-communicable diseases are becoming increasingly important, and there are really significant challenges to healthcare systems in coming up with sustainable and scalable models for how to manage these lifelong conditions that can't just be eliminated or cured with a course of antibiotics. We have a course on maternal and child health in low resource areas that's taught by Professor Neil Kennedy, who is a pediatrician that was based in Malawi for 15 years. Children and their mothers are among the most vulnerable groups in low and middle income countries with respect to their healthcare. But the converse of that is that investments in the health of these groups have some of the largest and most impactful returns on investments. I think it's particularly important to understand the health of women and their children. Finally, we have a course in global health development, a module in global health development. This is taught by one of my colleagues, Monica Burns, who is a lifelong global health practitioner. And this course is co-taught by a number of global health practitioners who talk in detail about the work of development, the Sustainable Development Goals, a number of the tools and perspectives that are needed and used by global health professionals on a day-to-day basis to help to better prepare you for actual work in this area. including information about the key stakeholders, NGOs, multilateral organizations, ministries of health, and how to effectively interact with them. There's also a research module which comprises the latter third of the year, and that offers both an opportunity to conduct research projects in underserved areas of LOICs, and also the opportunity for work-based placements where you can work with an NGO or other global health organization and help to create a document that will be useful for them in advocacy or other areas. So it's an opportunity to get a taste of global health practice in the field. So our graduate school is a kind of one-stop shop for postgraduate related queries and information. It's also a new kind of interdisciplinary hub, and it hosts a range of workshops for training, conferences, social events. It's also meant to be helping to support our postgraduates as they develop the skills that they'll need as they move on to their future careers. There you can see a link that you can click on if you're interested to learn more about our graduate school. With regard to fees and scholarships, you can see that the fee for international students is in the range of about £17,000 per year. There are a number of sources that can help to ameliorate that. All new international students that are enrolling are eligible for awards to reduce this cost. And early bird discounts of up to 10% are available by making an early payment. We do work with our students to try to identify sources that can help to defray their expenses with other costs. And then for domestic students, we have scholarships as well. Anyone who is a Northern Irish, UK, or EU resident, or from the Republic of Ireland may be eligible for loans for the full fees. So there are opportunities for students from various different backgrounds to reduce the cost of the course. Our entry requirements, we normally would like to see a minimum of a 2-1 or above honors degree or its equivalent. Professional qualifications such as the MBBS or BDS or BBSC can also be considered on an individual basis, as can work experience. Various international qualifications can also be accepted, and again, by clicking on the link there, you can gather more information about this. We get a lot of questions about English language requirements. We will look for evidence of an IELTS score of 6.5 or above, no less than 6.0 in any component, and that does have to have been taken within the last 2 years. Now, we're well aware that with COVID-19, many IELTS centers have been shut down, and we will be providing a link in the chat section towards the end of the talk today that will allow you to gather more information about what can be done if you're having difficulties in finding an open center where you can carry out your IELTS testing. So with regard to next steps, for those of you who are interested, if you've already made an application, you can or been accepted, you can now accept your offer on the direct application portal or by emailing us. So this is very easy to do. If you're an international student and applied through an agent, you can also speak with your agent for more information about your offer. Applications are still open for international students, and you see a link here on our direct application portal where there is still time to complete your application. And there's more information available on our website about how to begin that application process. So at this point, I'm going to recede into the background for a minute, and we'll together watch a video that will allow you to meet and hear from some of our MPH students. This Master's in Public Health and Global Health is really going to be built on the experiences and strengths of all of us in the department. And in that respect, I think it's going to be quite a unique program.
Each of the people working on the global health modules have a wide range of expertise and experience working in the field, understanding how health systems have to work so hard when you're not from a developed nation.
We have folks who are world leaders in their research around the eye, around diabetic eye disease, around diabetes, hypertension, and cancer. Those are increasingly important areas in low and middle income countries.
The programme itself will offer all sorts of insights into the politics and the ethics of health development from people who have been there and done it. The Masters in Public Health Global has grown out of what I might call a standard Masters in Public Health. What the Masters in Global Health at Queen's will offer is that solid grounding in public health topics and public health issues. But in addition, there are 3 modules which are exclusively taught from the perspective of less developed and least developed countries in the world. And those 3 modules are the non-communicable diseases module. Everybody working in less and least developed countries recognises that its non-communicable diseases are the big topic for the future, because unless we address things like obesity, diabetes and so on, we will simply have a less healthy population globally, and we won't be able to afford to pay for the health needs of those people. There's a module on maternal and child health services in less and least developed countries. And for that module, we also have a number of faculty who have both lived and worked for prolonged periods of time in countries where maternal and child health numbers have been really poor. And we've actually been involved in projects and programs in those countries which have supported reductions in deaths. And thirdly, my favourite module is the Global Health Development module, where we will cover issues such as the politics and the ethics and who is entitled to development assistance. So there are a wide range of issues, some of them really rather serious in terms of global development issues for the future.
It doesn't just offer an opportunity to learn about these building blocks of public health in a classroom. It also offers opportunities to carry out a thesis and get involved directly either in research or even in public health projects yourself.
After you've got your MPH Global, if you don't want to go on to do more academic work with a PhD, which is also available, this will enable you and give you examples of how you can access work through NGOs, through bilateral partners, through multilateral partners, and through UN agencies.
So I think it's a very exciting and unique program, and I very much look forward to welcoming students from all over the world. 特别是您来自中国的那个学生，欢迎您到 Belfast 来参加我们这个课程。
If you're interested in getting a solid grounding in public health issues and getting a really good hands-on experience grounding in global health issues, then this is the programme for you.
So I'm coming back on now, and I'm very pleased to see we have a number of questions that have already been submitted through the chat. So I'm going to go ahead and begin answering some of these. The first one to come through was, what is the difference between the MPH and the global MPH, the global health MPH? So both of these courses prepare you to function as a public health professional. But the global MPH has some particular focuses. Now, you would think global, we're all on the globe. Any country in the world would be fair game. And that's true to some extent. But in fact, The global MPH is particularly interested in those countries that make up 80% of the world's population that are low and middle income countries. Our reason for focusing on those is in some of the similar to why we have programs in women's studies. The rest of our healthcare system is really all about rich countries in the same way that the rest of our history courses are kind of men's studies often. We think it's particularly important to try to understand the particular problems of these low and middle income countries. 90% of the research dollars in medical research, for example, are spent in rich countries. But in my field, ophthalmology, 90% of the burden of disease globally is in low and middle income countries. The solutions that we're going to come up with need to be different in low resource areas. We also have particular questions about equity of access that are particularly poignant in low and middle income countries. So the tools, the focus, the questions, and the solutions will be quite different in these low resource settings. And that's really the major focus of the Global Health MPH, and really the major difference between that and the standard MPH. I have a question about what a typical timetable looks like. So our students begin their studies at 9 in the morning and are usually finished at 3 in the afternoon. However, there is a break for lunch, and certainly not every day is taken up entirely in the classroom. A lot of time is spent either preparing outside for the class day, either reading or preparing in groups. I would say that virtually 100% of the work that I do for Orbis International, as in my public health job, my global health job, is done in groups. Very rare that I do something on my own. So we have a lot of exercises, presentations, and others that are done in teams. And so a lot of your time would be spent working with those teams, preparing these exercises, commenting on or responding to published work, doing your own critiques, preparing for a research thesis, or preparing for a placement. So in addition to the lunchtime and the afternoon time, most students have the entire day free on Wednesday. So there is coursework. There is a certain amount of time that has to be spent in the classroom to learn some of these things, but we also allow a great deal of time for people to prepare and to learn on their own. Because of course, as global health professionals, your ability to learn on your own is going to be of crucial importance. We have a question about the work-based placement. That's often something of real interest. And the question specifically is whether these can be done in low and middle income countries. And the answer is certainly yes. I'll give you an example of a recent one. We had a student from Malaysia who is an optometrist that was interested to do some work around vision care that she's trained in. And through Orbis International, the NGO with which I spend some of my time working, we were able to arrange for her to travel to Mongolia and to do a project there around doing interviews with key stakeholders and pulling together data in order to write an advocacy paper advocating to the Mongolian government that they provide free spectacles for poor children who need them, showing the major advantages of doing that in terms of educational outcomes, and also advocating for stronger regulation of refractive services. Currently, these are regulated in Mongolia in the same way that you might regulate a nail salon or something. They're regulated as a commercial entity rather than as a medical one. But of course, when we're providing spectacles that will help to improve vision and carrying out examinations that may pick up other important causes of pathology, clearly it's important that those be regulated as medical activities. So this was an opportunity for this student to really contribute in an important way to a public health problem and help create an advocacy document to try to make real world changes in health policies that were affecting real children in Mongolia. So we have a question about whether there are fully funded scholarships for this program, apart from Chevening and Commonwealth scholarships. So Chevening and Commonwealth are good. The Wellcome Trust has support for some areas. The Newton Foundation for certain countries. So I think Brazil, South Africa, China, not every year, but occasionally will have support for programs like this. Many countries, China, for example, have got their own support for overseas courses like this. What I would encourage you to do is use the most powerful tool of all, which is a Google search, and have a look on the internet, putting in keywords that describe exactly what you propose to study, your own background, if it's particular medical skills that you have, or a particular area that you've worked in, a particular ethnic group that you are with, a particular country. Any of these key identifiers that will help Google to help you to find a good source of scholarship. Many of our students have been quite successful in finding support for the course in this fashion. And of course, our own staff may have suggestions as well. We have a question which we often receive about job opportunities after the course. We have students that are involved in a number of different areas. We have students that go on to get PhDs that are interested to become researchers. We have students that are working for non-governmental organizations. In fact, we had 2 students here before last who continued their work part-time for the NGOs that they were working with, and then went back to work with those NGOs, having received the training. We have students that will take on positions in government, and in fact, we've had several students who have taken leaves of absence from their government positions and then gone back to those government positions, working with multilaterals like the World Bank and others. So we have students who have gone on to do a number of different things after they've finished. And we do feel that our training provides students the skill set that they need to take on any number of different possibilities. So I'm not finding any additional questions. Let's see if we've got any more. Here comes one. And this is just Ms. McCann thanking you all. But do please, if you have further questions, anything else that you'd like to know, do feel free to use this email, askmhls, so it's askmhls @qub.ac.uk, and we'll be happy to answer any further queries. So thank you very much for your interest in Queen's and in the Global Health MPH. I hope that the information that we've given you today will be helpful for you in making a decision, and I'd be delighted to meet any of you this fall. And if any of you do happen to enroll here, you got to come up to me and let me know that you heard this webinar. I'll be curious about it. So thank you very much for your time, and I think that ends our presentation for today.